What is up, friends? I just wanted to come on and make a quick video introducing the clip that you're about to see, which is me in class, candidly going through a workout with my online participants, but presenting the Stuart McGill Big Three. Stuart McGill is a spinal health guru, for lack of a better term, PhD, several books for both professionals and lay people who just want to take better care of their spine. And his Big Three protocol are the central exercises among a collection of exercises that he recommends, but it's the central three that he recommends practicing regularly for your spinal health. So everyone from Olympic lifters and outdoor firefighters and athletes and to people who are having trouble getting up and down from a chair should be doing some variation of these exercises to rehabilitate or prevent injury in their spine. So I like to share them with my class. I've gotten great benefit from doing them myself. Everything I do in my class, I've first substantially worked on in my own body. And I think they're worth doing. So I rotate them into our workouts every couple months to refresh them for my participants. And here I thought I would post it online for anyone who either wants to follow along because they do or don't come to my class, wants to follow along during the months that I'm not doing them in class, or for those of you who would just like to see how someone like me presents them for a non-specific audience, right? Anyone who wants to practice them. I really feel like this is the place to start on the smallest, most conservative, most what I call inside job level. These aren't exercises that are flashy. They're not even really for big mover muscles. They're for deep core stabilization, which is part of our spinal safety, you could say, that's really missing from a lot of core strengthening practices. A lot of people immediately think planks and crunches, etc. And that a lot of that will be working superficial muscles if you and will be limited, problematically limited to working superficial muscles if you don't first develop the deep core strength that is really important for the segmental, the intersegmental, or you can think vertebra to vertebra stability of your spine, global stability of your spine, vertebra to vertebra stability of your spine. Work your spine, develop your spinal health regimen from the inside out. So first, with things like creating intra-abdominal pressure from the inside, tapping into the deep core strength of the muscles that these exercises really help you engage and bring awareness to, and then layering on all of the big picture muscle, the superficial muscle, we'll call it. Superficial not because it's less important, but just because it's external, more external to your body. Really, really powerful. You want the full package for your spinal health. Hopefully this is useful. And of course, as always, leave me comments, questions below. I will probably remake this video with even cleaner explanation, but I want to just get it posted because knowing me, it'll take me another year to do another demo. So here you go. Thank you for all of your support. And again, the questions really help inspire me to create content. So thank you. Who's still here? Stuart McGill Big Three. I'm going to turn off the music because I actually want you to be so focused to do this. And this is the last time we're going to do it together as a group this month. Just for the month, I'll bring it back. Okay, so the Stuart McGill Big Three. Our goal is to challenge our spine from different directions of gravity. Down on my back, down on my belly, down on my back, and laterally against my side. And in every situation, my goal is the same. For my spine to stay completely unfazed. My appropriate natural degree of lumbar curve is maintained. That takes internal pressurization around my spine. It's not just ab strength. And it's something a lot of us are lacking. And that's why this Big Three protocol he describes is for everybody, from power lifters to people struggling to get out of a chair. This is kind of the key to like a healthy back for life, is these among other exercises that he would recommend and that I would as well. But it starts with these three very foundational movements. So, and notice how related they are to our human development, being on our back, trying to crawl, trying to get over, etc. So the setup, there's curve in my spine. Only you know your natural degree of curve, but you're not pulling it into overarch and you are not rounding it into the mat. And when you feel your body want to round, or if you feel it overarch, those are signs that your internal pressurization is failing, okay? And it's recruiting ab muscle, which is not happy. That means every time you lose strength in your spine, you're bending it and totally distorting the alignment of your spine. Okay, so pressurize, find it. We're going to start with this tiny crunch. It's a micro crunch. I think I still have my shirt up so you can see, but I don't even want you watching me. Eyes are on the ceiling. And you're going to brace, find the air, and then lift your head and possibly your shoulders, whatever you want and can, and just crunch. Do some little micro crunches here, micro crunch. What did we say earlier about pulling your solar plexus in, right? Make it a thoracic movement, not a lumbar movement. And I know they connect, and so at a certain point, you're gonna start to feel, oh, I'm pulling my ribs up and it's beginning to affect my low back. I'm feeling those lowermost thoracic vertebrae start to pull on my uppermost lumbar vertebra, and I'm gonna stop there. Feel that, and just make it more intense. You can put your hands up, lengthen your chin back, do what you'd like, but I prefer you just make this like really quality here. You could be looking straight up. That also helps. Your eye line helps add some challenge. But notice if it's very hard for you to even lift your chin without your back rounding, or it can round from the rib cage side, or you might be tucking your pelvis. Either one is a sign of a breakdown. And that's what we're training for, right? This is not just for ab strength. There's lots of ways to strengthen your abs. Let this be triage for that very spinal protective movement. Okay, do a few, hold. Notice how important the air pressurization is. I think you can still see that my spine is off the mat. And lower, and break. Fill with air, take a few. Release. We're gonna work our way to tabletop. Let's go through our side plank, or our spinal isolating side plank. How do we wanna get there? Let's consider the rotation we did earlier. We rotated our spine, and I made this big fuss about your ribs being able to go before your pelvis. That is important for so many reasons. You need them to be able to move. You also need to be able to fix that and use it for torque power. So from your healthy spine position, right? You're crawling on the ceiling. You're crawling on the ceiling. Your spine has nice curve because you're about to twist it, and you don't want to do that on a flexed spine. Go to roll your ribs. Fight the anti-twist in your belly so that your pelvis gets rolled with you with some force. Don't just slither over and mess up your shoulder. Ab strength, power over, clear the shoulder, push the floor away, nothing. Okay, go both ways. Abs, go. All right, you're able to get that momentum because of the torque from your center. Babies figure it out. It's pretty amazing. It's absolutely amazing. All right, from here, I think that the easiest way to do this is with the hand, but if that hurts your wrist, then you can put the elbow down. This is also of all the three movements, this is probably one of the best for doing variations of, because you can do this against a counter, on a desk, on a chair. Your goal, though, is again, no movement in the spine, neither tucking it or overarching, and not letting it bend towards the floor, bowing towards the floor, and don't rainbow it up to the ceiling. Either one will be borrowing from oblique and lat strength to do the inside job of your spinal stabilizers. Global stability of the spine versus intersegmental stability. Pack from the inside, create the intersegmental stability, right? Put the bubble wrap in the box so that the precious vase isn't rattling around, and then put it in strong cardboard with duct tape on the outside. But if you just have the cardboard box and it's an empty box inside, you're gonna break out all your ornaments, right? You guys follow this, you follow that. Okay, strong. Shoulder blade is driving down your back. Back is long, hand is out to the side. It is not all the way back here. Find somewhere, kind of like thumb forward, because you're planting this hand strong. This is a tripod like your foot is a tripod. Find your neck. I'm looking up to talk to you, but find your neck alignment and find the length that your hips need to be from that arm for you to get a powerful push into the floor that you're going to bring your hips kind of up and forward. So they're going to have this trajectory of going slightly up and forward. You know, rearrange as you need to, but I want you to see that you stay planked here. And there is curve in my spine. I just cannot show you. Okay? I can't show you both angles. So if you're too far back or if you're bowing, and this again, different exercises, see Instagram. Okay, all kinds of beautiful stuff. This is not what we're doing today. Do this first and then do that. So find it, hold it. Power into that hand. Drive those fingers down the same way we drive our toes down. And just notice if you start to fail. Pressurize. Failure, okay, and then lower your hips as a unit. Don't slinky down. Lower. And again, if that is too much, just trying to lift off, but with good form, is great. And obviously use, let's circle around and do it. Use different level things so that you're not fighting so much gravity and so you can find a more comfortable hand position. But I will also mention these are all worth practicing on the floor if you can work towards it, because this is important. This is important to be able to do. Okay, when you're ready, set up strong. Strong. Find that corkscrew of the hand that lets you anchor strong into the floor. Lateral length. Brace your abs with the air. Send it down. Hover the hips. Consider lifting the hips higher, but you might have to adjust your stance so that you can keep your spine long and totally neutral. Shin, sternum, belly button, pubic bone. Stacked as if you were standing. Hang out, breathe, brace. The fail, what I was talking about with the fail is if you start to feel flickers in your spine, obviously if your shoulder's hurting, if your wrist is hurting, if something is hurting, that's a different issue. But the failure we're looking for is that your spine, your vertebra don't like this downward pressure of gravity. Take a second more. I think this is roughly about the same time. I just want you to make sure you check yourself. Are you bowing? Are you lifting? Compensations, they're not worth it. Lower with discipline. Remember, the starting position is great. And come up. So your spine, and then we're going to do our last one in tabletop. So if your wrists need a break, it's a big part of why we do this type of stuff, right? Is so that we have more freedom of movement in our hands and wrists, and we're training our shoulder health and getting our rotator cuff ready for bearing weight on our hands, something we're a little unaccustomed to from not walking on them anymore. Your spine gets scared about shearing force. So when it is sideways like that, and we're about to be on our hands and knees on quadruped, gravity on our back also is very tempting for our spine. All of these are tempting for our spine to get intersegmental, meaning vertebra to vertebra slide. It's dangerous for, our spinal cord. So it's dangerous for a lot of things. So our body doesn't like it if we can't control it. And that's what we're practicing. And that side version is hard. So practice. All right, where are we? My toes are bent back because I want an active pelvic floor and hips. And as I say, when we're on our feet, your glutes and things are getting information from the soles of your feet. So that activation is meaningful. If this does not work for you, of course, use a wall, use a counter. But let's do it, assuming you can get into this position or you're working towards it. Position is important here. So just like to the side, this is a no-go. I want, ideally, if you can, fingers at, if my middle finger were at 12 o'clock, and then I'm gonna bring it in maybe 15 minutes or a half hour. So my hands are a little bit more like inward. It's called radial deviation, slight deviation towards the radius. And then I squeeze my back, right? I gotta give those muscles a place to wind up from. So this is slightly exaggerated, but just to show you, okay? So don't start here because the back muscles don't have anywhere to go. Give them a good base, and then as I squeeze my lats, it pulls them down and it pulls my elbow and it locks me in, okay? So it's the back muscle stuff we do at the beginning of class. It all applies to the shoulder stabilization with some weight on it, which is part of this exercise. It's a big benefit of the exercise. So find it, drive those fingers down, squeeze your lats. This is me squeezing my lats and my serratus. Boom, pushing my hands into the floor. Not this. Don't be hanging that shoulder out to dry. All right, set up strong. There's your top body set up. Just fight with the floor for a minute. Push. feel your abs, come on. Pull in some air. Pressurize it with muscle. Press into those ribs. Again, press it into the sides. Bubble wrap all around your spine. Not pulling in air to distend the belly. That's just punishing your spine more with gravity. Pull in that air and pressurize to the lateral and to the back sides. And then let's talk to our knees. They're under my hips and I have spinal curve. At any point, you might just hanging out here, you might feel your back start to overarch because it's tired. Take a break. Notice that. You also might feel it be very difficult to not tuck your butt, which is a compensation that your spine is like, I'm getting shearing forces. Please send reinforcements. Please give me more cardboard because I'm not strong inside, but you already know putting your box in another box isn't going to help the vase inside. So that's not helpful. You have to build up this capacity. So if you're feeling that, take a break, make a note. Make a note. And it might be good to do this like, again, I know I'm out of the screen, but like against a wall, all right? Against a wall or something when gravity is not so dramatically down on you. This is the most aggressive way, but also it's not arbitrary, right? This is part of our development is coming through a crawling position and we might need to do this. So find your setup, find your brace, hang out, make this work. I always call it like attack the floor in a way that doesn't hurt, but you can put some muscle into this. Just fiercely defy gravity. Don't just be like, all right, gravity, I got you. No, you could stay, show off to gravity. You could stay here for an hour. All right, brace. And honestly, the advancement of this is going to be to bring those knees up. I think you can see my knees are up. And to be able to really hold here. That is not easy. All right. But if you can, and you'd like to start hovering your knees a little, awesome. That's kind of the progression of this as an exercise of intensity. Let's do the stability piece, which is removing legs from the table. And that's the actual initial Stu McGill exercise. So again, when we rolled over, when we got up from our side, we created torque, right? Rib cage, hips followed. Rib cage, hips followed. Here, I'm using that same anti-rotation. That's what I have to be able to draw on. I pressurize. The spine on the small level is safe. And then the big picture body is also totally stable. So that means if I lift this, it's like inviting right? It's inviting my ribs to fall, which would be destabilizing. I have to anti-rotate from this position. When you're ready, brace, squeeze those lats, long neck, lift a hand, and notice nothing changes. You don't shift over. You don't fall into that side. Okay? And if you do today, no judgment. That's what you're aiming for. Find as symmetrically a distributed weight on the remaining 3 points as you can. And I'm telling you, doing this while I talk is so much harder than when I do it for real and I pressurize with air. It's all about the abdominal pressure on the inside, which is a skill in of itself. All right, so march them a few times. I'm going to do it for real. Even though you're not watching me, you have your eyes probably a little above your hands. So your neck is long. Brace and march. You can, if you want to have a place to send that hand, send it to the opposite shoulder. Make sure you can do both. Notice if one side is wobblier than the other, totally normal. Lifting legs, same deal. I'll just stay here. But what I wanted to show you from the side is when you lift a knee, first of all, you don't have to lift the foot if you don't want. You can just hover the knee. Just try it. And then you have to lift that leg. You have to put it somewhere, right? If you just lift it straight up, you're going to roll over. You're going to do a compensation like this. You're going to like fire hydrant it, right? Which is an exercise, but that's not what we're doing. So I don't want you to do that. I want you to pull that knee under you, but without rounding your butt. So spinal curve, intact. Lifting the knee, bringing it slightly forward. Notice the parallel to like our high knees and stuff that we do in class. And I say, don't round your back, push into the straight leg. I want that leg to be able to move completely independent and for you to have a cup of coffee on your back. All right, no leaning, no dipping. Thank you, everyone, for this class. All right. I see some people hopping off, and I appreciate you for staying as long as you could. All right. Find the same thing, other side. Where's that knee have to go? If I just lift it, I'm going to either have to lean or I'm going to have to hike my hip. And both of those are direct compensations that are extremely painful for our spine and hip health when we walk. One is the equivalent of this, right? And one will be the equivalent of this. Lifting the hip or collapsing the hip. They're literally diagnosable dysfunction in our walking gait. So you're going to practice them here. Find it, brace, set up, hover it, make sure you don't dip, make sure you don't hike to compensate, consider moving it, but that's just bonus. Find evenly distributed weight on the hands. Make a note, the better, the harder, it's very hard to keep that leg in its track. We really want to do that. Try really hard not to. Try really hard not to, all right? And of course, online, you will see progressions of this. People doing a much more aggressive, advanced bird dog exercise is usually what it's called, lifting alternating hands and legs. It's great, but only if they're doing the quality inside job first. Let me give you one option for that, which is just to lift opposite limbs, but you don't have to actually extend them today. And notice how low my leg is back there, all right? It's low, because if it comes up any higher, it's a really pretty back exercise. It's just not what we're doing, okay? So find your version. Here today, let's start with hands, because I think it's easier to peel away a hand and then the knee. So doing opposite diagonals, which again, it's functional, not an arbitrary choice. We operate in cross body movement. I walk like this. I don't walk like a train, right? Walk with cross body. So activate that line, strong against the floor, brace. You're gonna lift one hand, lift one knee, and nothing moves. Just like if you're walking. Love you. Thank you for my waves. Here it is. Hand, knee. That was really hard for me. I have no air. I was at the end of a sentence. I notice a difference. Make sure you're doing this with discipline. I'm not really in my body to show you because I have to talk so much and I'm not focused. This is deep focus work. Inhale, breathe, pull. Hover, be perfectly disciplined about it. I mean, perfectly disciplined about it. And then bring the feet, the knee and the hand together, if you can. Together, if you can. Slightly away, if you want to try. The further you get away, the more temptation you'll have for the ricochet and the rotisserie action, right? But that is starting to really get you into more superficial muscle, and it's very taxing. So first, do the small inside job. Make sure you are very strong here before you tempt this. And then, of course, I encourage you to challenge yourself. I'm out of air. I'm wobbling because I'm out of air. Not because I'm not strong enough, because I ran out of the intra-abdominal pressurization from the inside. Other side. I don't know why I'm turning, but I will. Find it, build it, build the pressure, get ready to lift. This is a much harder side for me to do, by the way. Maybe you have a side that's harder for you. It's very common. And this is my more dysfunctional shoulder, and this is my more dysfunctional hip. Not a coincidence. When you're ready, pressurize, hand, drive, checkpoints, knee. It comes under you. You get a little rotisserie here. Get a little, right? A little. Find your strength. Find your balance. Use air. The air is like pressurizing the hub of the wheel. It's stabilizing the hub of the wheel so that the spokes can anchor powerfully. No matter how many spokes you have contacting the floor in this case, they are going to be a mess if the hub of the wheel is rolling around, right? So find that. And I don't even remember which hand I lifted. Hand, knee. Nothing moves. Nothing on the inside, no flickers. I'm moving a lot more than I would in my private practice. I'm going to do this for real. Wait until nothing is moving. Bring the knee and the hand together. Wait until nothing moves. I'm leaning. I'm going to regroup. Spinal curve is maintained. It's all about the form. Consider reaching into more of an extension position. No pressure to do so. Check your points. And then slow, oh, I got off balance again. Running out of air. When you're ready and not flickering and not wobbling, replace those points on the ground. Soft transition. Let's take a stretch. Hinge back. Hinge forward. Feel your spine stay with that curve as far as you can. This is actually a great exercise in and of itself with similar benefits in that I'm keeping the lumbar curve. I'm not punishing it, right? This is, our low back basically takes the brunt of anything we're not strong enough or mobile enough to do otherwise. Mobile or stable enough. So if my hips can't fold that far, if I lack hip flexion, I'm going to borrow it from my back. And that's not fair. My spine has enough work to do. It shouldn't have to do the job of my hips, which are fortified for this purpose. So rocking back, finding the angle of your hips in their turnout and in their width apart so that your pelvis can move comfortably. Again, toes up. And then if you would like to also invite a back stretch that allows your spine to softly round, feel the difference and know that you're doing it. Stretching your lats here. Resting your forehead on the floor if you want. Go ahead and take a strong breath. And as you do, push your belly into your thighs so that your back muscles float up a bit. All right, so I'm pulling in. I think you can see that I'm pressurizing here because my legs are in the way of my belly from going forward. It can't do that, so I have to send the air to my back. That is a good practice. And ideally, you don't even need your legs there to do it, and you'd be able to do that on your own. But if you can't, this is a great time to experience the pressurization that I'm doing on my back. And when I'm here, I'm pulling that air into those chambers along the side of my ribs, or the sides of my spine. This with the legs there is just a great way to get a more intense variation of that, if that's something that you have had a hard time developing. Feels like a nice stretch from the inside as well. You can really feel the tensioning in your thoraco lumbar fascia, which I've posted about how important that is for stabilizing your spine. Roll it up. All right. Thank you, everyone who's still here. Consider a lunge to stretch that front leg, or the front of the back leg. Ah, yes. And a lunge to stretch the back of the front leg, or the front of the back leg. I'm delirious from not taking in enough air, I think. And a little straddle stretch. Thank you, thank you. Questions, comments, let me know. Feel free to unmic. Let's release our neck and call it a day. Releasing the neck, the sides of the neck, sides of the throat. You already know, pull that chin back and forward, back and forward. Really tuck it. Really aim for your collarbone, not your breastbone, to stretch the back of your neck, sides of your throat. Last piece we'll do, bringing your chin up as much length as you can. Look powerfully over one side, opening your chest, not letting the opposite side shoulder follow. Reach, look further with your eyes. Oh, my light says class is over. Reach, look a little further with your eyes. You're trying to look right behind you, not across the street. Look right behind you. without forcing anything. And back to center. Thank you, friends. I gotta hop off. I have a meeting in 1 minute. But I've loved this workout, and I so appreciate you sticking around to the end. I hope it was valuable for you. And I hope I finally have a video that I can post on my YouTube channel for you guys to have as a reference going forward for when we're not doing this workout. Love you to pieces. I'm going to hop off because, forgive me, I am going to be late for my meeting. But feel